So, Lorna, we know each other very, very well. And one of the great things about working in the private sector and having worked in the private sector now for 25 years is continuity of care. But you predate me. You were here before me. So, tell me a little bit about your relationship with Mr. Gilmore before you were handed over to my care.
Well, 108 Harley Street was recommended. I mean, like all good things, it's word of mouth. And a friend of mine, quite a young woman, was treated by Jerry successfully, and they couldn't speak highly enough. And it wasn't obviously the care was important, it was more than that. It was the whole picture. What a lovely man, and very unstuffy and all that. Anyway, I came along. Trying to get an appointment with Jerry in those days was becoming impossible because he became so well known and so successful. So I got passed to you.
Yes.
But things haven't changed very much here. I know that you do a lot more here now, a lot more. But it's just the same. It's, I don't know, it's friendly. It's, the really good thing is you get everything done here. I mean, years ago, you would have to go and get your appointment with your consultant. You'd have to go get your mammogram, then you'd go somewhere else to get this, that, and that. This is it, it's all here.
Yeah. One of the things about Jerry I think people don't really realise was that he was a great innovator.
Oh,
so
yes.
for his time.
Yes.
And he right up until the time that he left the practice, he always insisted that we had the newest equipment, the most input with the secretaries, and worked with the people in with the highest degree of expertise. I think because he was so busy, he could sort of generate that big following with expertise in radiology, pathology, and we always had meetings. So every single case that we discussed, I mean, back, actually the first time I started working here was in 1995, before I became a consultant.
Oh, really?
So I wasn't a consultant until 96, but I did a few clinics earlier than that, just as a sort of a locum as an associate. And I remember the first clinic that I did here, I saw 4 ladies and a princess.
Of course.
Yeah.
That was always the thing, that was the innovation here, everything under one roof. And also, you know that Jerry was so particular, that everything was top notch, that even if you couldn't see him, you knew that whoever you were seeing in practice had been really vetted and was going to be the best there is.
Well, yeah, myself and Fiona McNeil, I mean, you can't get much more vetting. And we were medical students on his firm in 1981.
Oh, God.
So Fiona and I started at Bart's in 1978, and our first clinical attachment was Jerry's firm in Hackney, in the old Hackney Hospital in 1981. So we'd known Jerry would have known him now for 40 years, pretty much.
I mean, a big presence. I mean, not just physically, but I mean, he really was. But totally in control here, completely.
Yeah, and I think that's one of the big differences between the system of medicine then and the system of medicine now. Now we've got the CQCs and the GMCs and the revalidation and all of those sorts of things. Whereas in those days you just had one big authoritarian character who made absolutely sure that that everything was done properly. And Jerry used to look at everything that we'd done as well. He would sort of look at, I got a letter once because I forgot to write in the patient's notes. And I got what we used to call the naughty letters.
Could you better must try harder.
Yeah, you omitted to write in this patient's notes, which was quite fantastic because he just sent me a cheque for that month's work and he'd omitted to sign it. So I was able to send him a letter back to say, and thanks very much for pointing that out, Jerry, and here's your cheque which you omitted to sign.
I suspect he did that deliberately.
You think?
Yeah, I do. But do you think things, I mean, apart from the practice growing enormously and the facilities, fantastic. Do you think it's changed much? I don't.
No, I mean, this room is pretty much the same as it always was, freezing cold in the winter and boiling hot in the summer, which is why I prefer my little consulting room.
The cupboard.
Yeah, the cupboard. Yeah. So when I first got moved to the other consulting room, one of my patients came in and said, "Oh, have you been naughty?" And I said, "No, look, this room actually suits me so much better. It's warm in the winter, it's cool in the summer. You've got a much more sort of intimate space for the patients, and she said yes. In the big consulting room, it's a bit like consulting with God.
I didn't want to say that, but that's exactly, yes, that's what I thought. But you know,
So I know this room never really suited my style, because you're kind of looking at peering over the desk to these patients who are right sort of down there, like, you know.
and actually you're right, because the small room, because generally speaking, if you're here, you are concerned about something in your life, and it's friendly in there. You know, you make people feel comfortable. And I mean, I've been seeing the same radiologist downstairs that does the mammograms for 19 years.
Yes.
Same lady,
Yeah,
same staff.
yeah.
So you must be doing something right.
Well, I think the continuity of care thing is actually very important. I mean, I've had a patient once who just walked in and she was white as a sheet. And I just took one look at her and I said, "You're the colour of those walls. What is wrong with you?" And she said, "I've been to see my GP 4 times saying that I wasn't very well." And he said, "Oh, it's the menopause, don't worry about it." I did a haemoglobin and it was 4. But I knew from the fact that I knew her from before that that was not a normal state for her to be in. And I've done that quite a few times where you just look at somebody and you say, "That's not right, that's not you, that's not the sort of, that's," I don't know, it's for somebody who had hypothyroidism, just took one step, and she'd been treated for breast cancer, and then she was sitting in the waiting room and she patently looked completely different. And I thought initially it was her kidneys, but did a few blood tests and found out she actually was hypothyroid.
Not what she came here at all for.
Yes.
That's service for you, isn't it?
Well, one of the reasons that I became a surgeon was because I never thought I was good enough at medicine to be a GP, but I think over the years I've got better.
Okay, then.
I've improved.
But you are
I'm quite good now.
You're certainly the bee's knees when it comes to surgery.
Oh, thank you.
And I mean, what are the next plans for 108?
I think for 108, I think we continue to keep up with all of the innovation with the equipment, so make sure that we stay on top of that. We now have a different form of MDT, which is much more similar to everybody else's. So we have an MDT every week. So we discuss all of the patients who have biopsies and things on a weekly basis. And of course, that was a COVID innovation because once COVID happened, then we no longer had meetings in person, and so everything was done on Zoom. So it's much easier to get together on Zoom. So I'm in a clinic in Orpington. I'm doing my MDT at 108 at 11 o'clock on a Friday morning.
Yeah,
in fact, I was in Paris last time. We did a Harley Street one last Monday.
I came to see you during, well, obviously not during COVID, but not during lockdown, but when they lifted the lockdown, we still had all the COVID restrictions. Still got the usual reminder, "Dear Mrs. Millet, you're due for your checkup." And, I was quite surprised. I thought, "Well, are you going to be operating?" "Yep, no problem at all." Temperature at the door, mask, exactly the same. I mean,
Yeah, we closed down in the first lockdown. We shut for about 3 or 4 weeks because we couldn't really do anything because there were no anaesthetists and no ventilators anyway. So the NHS had commandeered all of the ventilators from all of the private hospitals. So we couldn't do any surgery, and so there wasn't very much to do for 3 or 4 weeks. And then after the first 3 or 4 weeks, we started getting going again, but with greater social distancing, not allowing so many people in the waiting rooms, and making sure that we didn't send people down for X-rays unless there was enough space, and everybody wearing masks, everybody hand washing, and all those sorts of things.
But honestly, actually, it did feel, I suppose, it felt less busy than usual, but that was obviously deliberate by just pacing everybody out. But no problem at all.
Yeah. And I did quite well. I managed to get to Christmas without getting COVID, and then I got COVID over Christmas.
Oh.
So
good time to get
Yes.
Perfect.
I know. It was classic. I did my last clinic on Friday, and then on Saturday I stopped for a 2-week break, and got flu-like symptoms, sent off for a COVID test, and it came back positive. I thought it was just my normal end of termitis, but in fact it was COVID. So it was ill over Christmas. So. But a lot of my colleagues, breast surgeons, got it in the first wave. I think being that close to people made it difficult.
Yeah, well, let's hope we don't have another winter like that.
Yes.
We really don't need it.
Yeah.
But I mean, so the impact on the practice has been, well, actually, truthfully, never mind the practice, the impact on the patients.
Yeah.
I mean, surely, people are desperate to see a doctor.
Yeah.
Desperate.
Yeah.
I certainly I haven't had a face-to-face with a GP in 2 years, something like that.
Yeah.
And it's no good. As you quite rightly said earlier, you have to
Well, I think that is something that's changed as well. I mean, one of the reasons that Jerry was so successful was because he did have a very good relationship with GPs and communicated with GPs very, very well. But I think now we're getting much more of a sort of a corporate clientele where the insurance companies are actually allowing people to come direct without going to see their GPs.
Are they? That's interesting.
Yeah, so that AXA, Bupa, Aviva, Vitality all have specialist systems where they can book patients directly. And so
That's much, because actually if you're ill or you're worried about something and you have to go through the drama of going through your insurance company first, it is a bit of a nightmare. I didn't know that.
I think that the GP's probably got enough to do without, and at the end of the day, they can't really deal with patients with breast problems, because patients with breast problems have got to have an ultrasound, and if they're over 40, they've got to have a mammogram, and they've got to have an examination by a specialist, no matter what the symptoms are. So I think that all patients who do have breast problems, even for reassurance or talking about family history.
Absolutely. I mean, I have to say, once a year, I come and see you once a year, and we go the same procedure, the mammogram, the ultrasound, and then I see you. And it takes about no more than 2 hours, if that.
Yeah.
Done for another year.
And I think it is a lovely system that we've got where we can do the imaging first.
Yeah.
And not have to see
Come
somebody. Yeah. So with the new patients, I would see the new patient first, then send them down for imaging, and then see them back with the result of the imaging. Yeah.
No, I mean, it works so well. It's just not a drama.
Yeah.
I mean, I know it is for, obviously some of the patients, but and actually after you've had your mammogram, your scan, you're sitting in the waiting room, and you've just got your fingers crossed, you just think, let's hope this is all good.
Yeah.
I mean, it's, the staff are great, they're comfortable, they're warm. The tea's not bad, but could be better.
Yeah.